The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to be talking about a very important subject, heart disease, actually deadly plaques that can build up in the heart and how to reverse them. And talking with us today about this important subject is Dr. Hans Diehl. We're glad you're with us today.
Here, Don.
Thanks for making the trip from Loma Linda. And you've lived there for a number of years and developed an exciting program called the Coronary Health Improvement Project.
It's a long word, isn't it?
Or the CHIP program.
Much easier. CHIP.
Yes.
C-H-I-P.
So coronary, that's the arteries, the crowning arteries of the heart, and you want to improve that.
That's right.
So that's probably related to this topic today, reversing deadly plaques.
Yeah. You know, heart disease is the #1 killer in our society, responsible for every second death. 100 years ago, difficult to find this disease. Coronary artery disease, hardly known. They couldn't find it. Today, #1 killer disease in our society. And yet people have the idea that heart disease, there must be something wrong with my heart muscle, with the heart. And they oftentimes don't understand, as you see on this graphic here, that it's the arteries, the coronary arteries, that are the pipes that are supposed to bring oxygenated blood to the heart muscle. They become corroded. They become narrowed down. And I have a roller that might perhaps illustrate this a little bit better. You want to take a look at it?
Sure, we can look at that and see what happens here.
I woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery for coronary artery bypass surgery in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test, and when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's a yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, "Mr. Phillips, did you eat before you came to the hospital tonight?" He said, "Yes." I said, "What did you have?" He said, "I had a cheeseburger and a milkshake." And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. Well, 30, 40, 50 years of keeping your blood very fatty creates changes in the blood vessels that are very dangerous.
Over the years, arteries can become clogged with fatty material. Then a blood clot can form, blocking the blood flow completely. If the artery leads to the heart, the lack of oxygen can cause heart muscle to die. That's a heart attack. If the clogged artery leads to the brain, the patient has a stroke.
The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
Can just 30 days bring a drastic change for the better in your health?
Wow. So that surgery, they were actually pulling out these atherosclerosis. Someone told me that atherosclerosis means hard and soft. So those must have been the more soft deposits they were pulling out there.
Yeah, this is what narrows the diameter of the artery so you don't bring enough nutrients with the blood to the heart muscle and to other parts of the body.
So heart attacks, come from this. All kinds of things. Wherever the circulation goes, if it cuts off, it says you get a stroke. Suppose if it cuts off the supply to the reproductive organs, you're impotent. So these are things that we don't want to take lightly.
No, as a matter of fact, you can also have hearing and vision impairment because you don't bring enough oxygenated blood and nutrients to these organs. Or senility. Part of the memory loss is directly associated to the vessels, the arteries to the brain, no longer being able to bring adequate oxygen to the areas. It's a very, very deadly situation.
With these heart attacks, you know, it said that you looked at that blood tube and all there was that fat from the beef and all those different things. The blood fat was increased, I guess. I mean, I often saw a lot of heart attacks in the morning in the emergency room, right after that big, huge, fat-laden breakfast. Is this the reason I was seeing those?
Probably true.
Okay. So this is a process that begins when?
You know, people thought it happens when you're 60 or 70, and they thought, well, you know, I can make some lifestyle changes when I'm getting close to that age. Now we're going to realize that this is happening to teenagers. Take a look at that next slide. You see the progression there. We're born with clean arteries. By the time we're at 20 years of age, we already have 20% narrowing of the coronary arteries. By the time you're 45, 50 years, half of the diameter is already taken up by these plaques. And look, at 70, you're just barely making it.
So this is something that we really need to be concerned about when we're born, but we're not able to think about it when we're born. So our parents need to be feeding us the right things.
Yeah, we cannot start early enough, can we?
Okay, so what is it then that happens? What does this cause? We've seen it's caused this, but what is the process? How do we have that heart attack? You know, people just said, well, he was so healthy, but then he had that big one. What happens?
How could it have happened, right?
Right.
I mean, he looked so good.
I've heard that many times.
A random act. Oh, no. Let's take a look at the next one. Here you see what the arteries are not supposed to look like. You see the narrowing there? This is the plaque buildup in this particular area there. You see the yellow material? This is the cholesterol and the fat buildup that you saw in the roll-in. But you see here, if that small pathway there gets obstructed with a blood clot, it interrupts the blood flow to the heart muscle, and that's what we call an infarction. That's a heart attack. That's usually a life-threatening event.
Now, you know, I used to work in different parts of the hospital, and I saw someone that was young as 14 have a heart attack. And so it's not just for someone that's 20, 30, 40. It can even hit in the teens. Is this something that's happening more as obesity goes up in America? Are more and more young people having heart attacks?
We are seeing, yes, we're seeing younger people at higher risk now than perhaps 20, 30 years ago. And it has to do with a special risk arch. In that risk arch from the Framingham study, you see certain risk factors identified. Take a look here. These are largely under the control of our diet, how we eat. You see the cholesterol as the most powerful one, followed by smoking and high blood pressure, that deadly trio up there.
Why are they different colors?
Well, the red is usually diet-related, and then the orange is a lifestyle-related type of a thing. Then you go to the left, you see the diabetes. You see the obesity, both diet-related, and on the right-hand side, you go down to the triglycerides, these blood fats, and then you have an inactive lifestyle and stress.
What about age, genes, and gender? You have those in green. What's that mean?
Yeah, they're also contributing to this disease process, but there's not really much you can do about changing your age or your gender or your genes.
If you're thinking about doing that, it probably won't help, right? It doesn't help in terms of your coronary artery disease. Okay, so these in the red boxes there, diabetes, hypertension, cholesterol, triglycerides, obesity, those are all things that we can do something about.
Yeah, especially as it relates to our diet. I mean, you can also do something about the exercise. You can do something about handling your stress more appropriately, and you can do something about your smoking. But the red boxes, you're right. This is something where we can make a significant difference because of what we put between our lips. Food.
And we don't have to smoke either.
We don't have to smoke either, that's right.
All right, so where do we get this whole, you said from the Framingham study. What do you mean?
That's sort of the ultimate gold standard study that has been going on for 50 years that identified that these factors are driving this disease, atherosclerosis in the arteries. And what's very, very interesting is that we began to understand after World War II that these plaques can actually be reversing themselves. You don't have to have this disease. And if you have 50, 60%, there's every good reason you can regress.
So how did World War II help us understand this?
Well, you know, when the Nazi tanks crossed the Polish boundary, people found themselves, millions of people, thrown into a massive dietary experiment. You see, the Nazi armies, they took all the foodstuffs of the occupied country to feed their troops. So these people now had to live on very, very simple foods. They had to oftentimes grow their own food in their backyards. And as this happened, within a year to 2 years, you could see a dramatic decline, amazing, isn't it, in heart disease, in diabetes, in high blood pressure, in cancer rates.
I think you have a graphic on this that shows that, actually.
I do. Here you see, in short order, on the left-hand side, you see the amount of, the number of deaths from coronary disease, and then you move towards 1936 to 39, World War II begins, and within a year, you can see a dramatic decline in the number of coronary deaths per 10,000 people.
And this is because the Germans took all the bad food, and all they had left was good food.
Well, we didn't know at the time that it was bad food, but what they basically did, they took all the livestock and to feed their armies. And we begin to understand now a little bit more that when you have livestock, you have a diet that's fairly high in animal fat, cholesterol, and so these are then sort of contributing to the disease. But if you have less of this, apparently from World War II we learned, first time, they can actually decrease these diseases.
So they saw this across the board. This got their attention, the researchers.
Yeah, they were absolutely amazed. And you see, then they followed up and they said, now, if this is really related to diet, what would happen as the countries begin to get back on their feet again and over time adopt their previously fairly rich diet? What would happen to the low disease rates for heart disease and diabetes and so on? And that's what they did. And take a look back at this previous graphic. Here you see again what happens. World War II.
Yeah, goes down.
It goes down. Then it flattens out. It stays there for about 20 years, just about. And then what happens? It goes up again.
Is that when they said, what was it, FDR? Someone says a chicken in every pot?
That's probably right. That's right.
So when the chickens came back and the piggies came home, so did the heart disease.
That's right. That's it. You know, there was a professor in Belgium. He was very famous. He was a pathologist, Professor Picard. And everybody wanted to study with this famous pathologist. And he was the first one to observe that as he was doing autopsies, that the arteries towards the end of World War II were much cleaner, they were wider, they were more open. And he said, isn't it amazing? World War II, with all the stress and the anxiety, actually did not cause more narrowing of these disease processes. And then they said he was mumbling to himself in the 1950, 55, 1960s. Students were telling me that actually later on, he said he was mumbling under his breath, they're coming back.
They're coming back.
They're coming back. And then finally, one of the more courageous pathology residents approached this famous professor and he said, now, Professor Picard, what is coming back? What is coming back? He said, of course, the plaques are coming back. You know, this narrowing of the arteries. So it's interesting that World War II taught us something about you can diminish and you can actually later on increase these plaques.
Well, I guess there is some benefit that came out of World War II. Well, we've been talking with Dr. Hans Diehl. We're talking about coronary artery disease, the deadly plaques, and we've got some good news. We learned from World War II that these plaques can be stopped and even perhaps reversed. We're going to look at some exciting studies when we come back.
Are you confused about the endless stream of new and often contradictory health information? With companies trying to sell new drugs and special interest groups paying for studies that spin the facts, where can you find a common-sense approach to health? One way is to ask for your free copy of Dr. Arnott's 24 Realistic Ways to Improve Your Health. Dr. Timothy Arnott and the Lifestyle Center of America produced this helpful booklet of 24 short, practical health tips based on scientific research and the Bible that will help you live longer, happier, and healthier. For example, did you know that women who drink more water lower the risk of heart attack? Or that 7 to 8 hours of sleep a night can minimize your risk of ever developing diabetes? Find out how to lower your blood pressure and much more. If you're looking for help, not hype, then this booklet's for you. Just log on to 3abn.org and click on free offers or call us during regular business hours. You'll be glad you did.
Welcome back. We've been talking with Dr. Hans Diehl. We've been talking about heart disease and deadly plaques, and we've been talking about the fact that they can be actually reversed. Dr. Diehl, this was good news coming out of World War II. These risk factors were first of all kind of begin to percolate in the minds of scientists like that pathologist, and we saw that people's heart disease actually came to a stop from 1939 to the 40s and into the 50s.
And then came back.
And then came back when the piggies came back. Or when all of the meat products and all of the dairy products, the things that were not abundant during the war, came back.
You know, it created a lot of new research models. They wondered, couldn't we take human beings, feed them a very rich diet, and then after 15 years, we asked these people, now would you please surrender your bodies now so that you can do the autopsies and then we know for sure what's happening? You know, they thought about this and they said, well, we probably won't find too many volunteers for this experiment. So, so they began to think about other models, and they looked at monkey studies. So I looked at rhesus monkeys, baboons, and said, baboons, monkeys are somewhat, in many ways, somewhat similar to the human anatomy and physiology. Maybe we can learn something from these experiments. And here's what they did. They took these innocent-looking monkeys and forced them to eat a typical Western diet, rich diet.
I'm sure the monkeys didn't appreciate it.
Well, they actually put the cholesterol into the bottle of the usual drink that monkeys can live on, and they were actually fed these diets through bottles.
I see.
These were young rhesus monkeys. They later on did it with larger specimens. And the one that's really, really sort of standing out in my mind, as the data came out more and more and more, that if you feed animals, especially monkeys, a rich diet, they will always have heart disease coming up. They did this experiment in Chicago. They took a typical university or hospital diet.
A hospital diet. Well, that's hitting it close to home.
That's right. And then they had these baboons. And they fed this typical hospital diet to these baboons, and within 19 months, the baboons had died of massive heart attacks.
Better stay out of the hospital.
Well, don't stay more than 19 months.
That's right. Man. So just this typical hospital diet.
Well, you know, it's just kind of a basically rich diet that is not in the best interest of people. So then they asked the question, now what would happen if we took a colony of experimental monkeys and we fed them different kind of diets, and we create this atherosclerotic plaque in their arteries, and then we give them different diets once they have about 80% narrowing. We give them a very simple diet.
Okay.
If we would give them a diet that was perhaps found in developing countries, like a lot of potatoes and grains and beans, fruits and vegetables, simple foods, what would happen to these monkeys?
And they did that, and what happened?
Well, they were absolutely astounded. Within 2 years, they found that instead of being 80% narrowing, they actually had opened up to 40%, 30%, and 20%, just in 2 years. So the good news is you can turn it off. You can reverse this disease, which is at the very basis of most of our health problems in America today as far as chronic disease goes.
Now, you have a program called the CHIP program that covers all these kind of studies and helps people see exactly what you're describing to us. But undergirding that, there were studies by a couple other doctors I think you're going to share with us.
Yeah, there were quite a few researchers in the last 30 years that have demonstrated very successfully that what happens to monkeys and baboons can also happen in human beings. It started some time ago with a man by the name of Nathan Pritikin.
Okay.
He was able to give people a very simple diet, even though they had heart disease, and tremendous, tremendous improvements. But we never knew, did it really open up these arteries, or did these people just feel better? Yes, they had less cholesterol, they had less weight, they had less diabetes, but can you really open up these arteries, which are oftentimes, you know, these plaques like...
So you had to take a picture of those, get someone to do that.
Yes, and in those days we didn't have the technology in place. Then along came a young cardiologist by the name of Dr. Ornish. Dean Ornish. He took the Pritikin concept of a very simple diet and added stress management to it. And then he took some 50 patients with heart disease and he divided them up into two groups. One group would receive the typical American Heart Association diet. The other one received a very simple diet, basically a vegetarian diet, foods as grown, very low in fat, very low in salt. I mean, it's a very, very simple diet. And here you see his picture.
Okay.
You can see the man that apparently is shaking up American medicine, because he basically challenged the idea that maybe we don't need so many bypass surgeries. Maybe we don't need that many angioplasties. You know, maybe we can just help people to make some simple dietary changes and you can accomplish the same thing without all the risks of surgery.
So what happened?
Well, in 1 year, on following a very simple dietary program plus exercise and stress management, he found that the arteries had opened up again, and some 80% of these people no longer had chest pain in the arteries within weeks.
And he documented that as well with pictures.
Special angiographic pictures. You could actually see how the arteries began to shrink down, opening up again so that more blood could flow to the heart muscle, and thus you can alleviate the chest pain.
This basically is what happens in the CHIP program as well. That's a documentation of what your programs do. What is it, about 40,000, 50,000 people now that have gone through those, communities across the nation. You have a webpage called chiphealth.com, and on that webpage you can learn more about this if you have an interest, and many people are having an interest. In fact, there are some states here in America, the entire state is looking into adopting this program, I hear. And the studies that Ornish did, and another one you're going to share with us, kind of undergird what you're doing, but you also have 5 or 6 studies now that are done right on the CHIP program, isn't that right?
Yeah, our results have been validated consistently by measuring the changes in cholesterol, the changes in weight, in the rate of diabetes, in hypertension. You know, this is all very, very well documented. We're very excited about it. And we assume that if we had some very special testing done, that we probably could show within a year's time what Dr. Ornish showed, that you can actually open up these arteries again.
And one of the reasons for that is because there's another doctor that's kind of done that. I think you're going to talk with us about him now.
Yeah, as a matter of fact, we have a picture of him there. Here's Dr. Esselstyn. Dr. Esselstyn has been involved in a major study at the famous Cleveland Clinic. What he did, he took patients with heart disease, and he said, because we can no longer operate on you, there were certain limitations to doing bypass surgeries on these patients. Why don't you come into my program and I put you on a very, very simple diet similar to Dr. Ornish. Now, what he did differently was he didn't introduce stress management, and he didn't have them walking as such. He just said, I want you to really bring your cholesterol down by eating a very simple diet, because his idea was, if I get the cholesterol down to 150, 160, 150, that's the same as about 4.0 in Canada. If we can bring this down with diet alone, we probably can demonstrate that diet is a very powerful factor, and that's exactly what he did. And on the next graphic, you see the actual regression of this disease. On the left side, in the very left side, you see the narrowed artery at the top left there. You see the narrowing there.
Yeah, and then I see that black line on the right side. Is that where it was before?
That's where it is. And then you see it on the right-hand side. You see it wide open there. This is a 30% regression in the right coronary artery in a 54-year-old man. Now, he has not just done this in one patient. He has now a number of patients that he has followed for over 12, it's actually 18 years now. And the results are absolutely tantalizing.
Mm-hmm. So, in other words, when you say regression, it just opens up.
It opens up.
It opens up. And that happens consistently if you get the cholesterol below 150.
That's correct. He did this mainly with diet and, if necessary, with some medication. But you see, it's not just the artery opening up to the heart muscle, the coronary arteries, which would help with heart disease. But you're talking about all of the major arteries in the body that begin to open up. So you have less to worry about impotence.
Mm-hmm.
You have less to worry about gangrene in diabetics, which leads to amputations often. You have less to worry about the possibility of narrowed arteries to the brain and strokes, hearing loss, vision loss. This is big time.
So these physicians have done this elegant research that's really documenting something that common sense pretty much tells people. I mean, you always hear, eat your vegetables, eat your fruits, get away from those things, they're not good for you. And what you do in the CHIP program is really help people know how to do this.
Yeah, but you know, that which is common sense is oftentimes not very commonly done.
Mm-hmm.
And so we're trying to bring the scientific data from studies around the world to come into a program of 40 hours of instruction so people can make wiser choices, better choices, adopting a simpler diet, a better diet, do something about their exercise, do something about their stress, and perhaps begin to recognize that we are wonderfully and fearfully made.
Well, I mean, that's kind of the bottom line. Ultimately, science is just really a documentation of what God has set in place. Am I right or am I wrong? And this really shows the power of God's plan for man. Do you
That's
agree?
absolutely right. We have a responsibility, we have an opportunity to be good stewards of that which was entrusted to us, the ultimate engineering marvel, the human body. I mean, think about it. 60,000 miles of circulatory system. Perfect health depends largely on perfect circulation. And we can change that by adopting a simpler lifestyle.
Thank you so much for being with us, Dr. Deal. And thank you for being with us today as well. If you want more information, go to chiphealth.com. But we're glad that you've been with us today, and we hope that you can put these principles into practice, and as a result, have health that lasts not just for now, but for a lifetime.